Doctor, we are live now, doctor.
Okay. So Arshi, I'll start. Yeah. So a very good evening, everyone. A very warm welcome on behalf of Team Yosi, Yosi Socio-Cultural and the Glaucoma Focus Group. We have a very interesting Glaucoma Week webinar planned for you today. So what it is, we'll come to know as we move ahead. So this is in lieu with the next week being the World Glaucoma Week. So let me first introduce you to the Governing Council of the Yosi. As President, we have Dr. Divakan Mishra, Dr. Sonal Kalia as the immediate past President, Dr. Karan Bhatia as a Vice President, Dr. Nilesh Kumar as a Secretary, Dr. Aditya as a Treasurer, and Dr. Prasanna V. Ramesh as a Joint Secretary. And this is backed up by a very dynamic pan-India executive team as it's for you on the board. So over the last, Dr. Sonal Kalia, during her tenure as president, formed a lot of presidential working groups, and Yossi developed a lot of arms which are further increasing. So one of them is the Yossi Socio-Cultural Group, and Glaucoma Focus Group has been added this year. Next slide. So Socio-Cultural Group has conducted a plethora of activities as on the screen over the last couple of years. And so we've had reels, we have photography, creativity contests, Rangoli, art, poems, health and mindfulness, and beyond sessions. This is the socio-cultural team headed by me, then Dr. Raki, Dr. Priya, and Dr. Sunandani, a very dynamic team. We celebrated the World Youth Day starting this year. Then we celebrated the Eye Donation Fortnight webinar with Cornea Society of India and the Eye Bank Association of India. Then we also have the Photography Day celebration as ICI Everywhere contest. Next slide. Then we also celebrated the Yosi World Tourism Day, which was a very interesting celebration of reels of conferences by young ophthalmologists. Next slide. And then we had the International Creativity Contest, which also had a lot of international young ophthalmologists participating on the theme I Love Your Eyes, Kids. Next slide. We also celebrated the Children's Day this time with Yo-Yo. So young ophthalmologists of Yosi, they participated with their parents as reels. Next slide. And then we also celebrated Christmas in our style as Christmas cheer with Yossi. We had a wonderful musical contest to it and Christmas cheer reels. Just this Monday, we had a wonderful celebration of Celebrate Your Mentors contest, which was beautifully, young ophthalmologists submitted reels of describing or celebrating their mentors. Next slide. And today we have this very interesting Glaucoma Week webinar. So this webinar has young ophthalmologists showcasing their artwork relating to glaucoma awareness and interesting reels relating to glaucoma awareness. And this is a part of contest. So this is the next slide. So we also have the very dynamic Yossi Glaucoma Focus Group. So over to you, Arshi, to introduce your team.
So thanks to Yosi, we have a glaucoma focus group that consists of me as the team lead, Dr. Prasanna V. Ramesh as the guiding person always, Dr. Sahiban Sethi, Dr. Amit Pandey, Dr. Anu June, Dr. Neha Medha, Dr. Reenal Pandit, Dr. Menak Bhattacharya, Dr. Megha Ji, Dr. Shivam Gupta, Dr. Niyati Unyal, and Dr. Soumya. So there are ophthalmologists here, glaucoma specialists from all spectrums of training. We have also we have a fellow who's just started training, and we have people who've been practicing for more than a decade. So we are very happy to welcome them into this group, and we thank Yosi for the opportunity for the creation of this group and for helping us conduct this webinar today. So without further ado, let's move on to introduce our esteemed panel of judges for today. So we have Dr. Satyan with us. Sir has an experience of more than 30 years in ophthalmology with 20 years at Arvind Eye Hospital, where he was the Chief of Glaucoma Services. Sir is right now the current President of Glaucoma Society of India, has also been the ex-member of AIOS Managing Committee with multiple honors to his name, including the Most Promising Research Presentation Award by the GSI and the Best Patient Care Project Improvement Award by the AAO given to him in Las Vegas. Sir, thank you so much for being here with us today. I would like to introduce our next judge for today, Dr. Gauri Murthy. She's a senior consultant and head of glaucoma services at Prabha Eye Clinic and Research Center and Vittala International Institute of Ophthalmology. Ma'am has extensive experience in managing refractory and difficult glaucoma with implants, endoscopic surgery, management of glaucoma in children, and has multiple papers to her resume. She has presented multiple lectures and has won multiple awards. She's the recipient of the IGO Platinum Award and is also involved in a project NENA that empowers rural and semi-urban women and urban ophthalmologists. Thank you so much, ma'am, for being with us today.
Yeah.
The next speaker is Dr.
So our next judge is Dr. Vinita Ramnani, ma'am. She's HOD Eye Department, Bansal Hospital, Bhopal. She is Vice President of MPSOS. She has recipient of awards ACOIN, BOA, Sadhguru Medal in Sadhguru Conclaves, and many more. She is ex chairman chairperson Scientific Committee MPSOS, ex secretary Vice President of BDOS. She has a work experience of 30 years, performed more than 30,000 eye surgeries, and she is third best rated ophthalmologist of Bhopal for consecutive past 5 years. She has invited guest faculty in various local, state, national, and international ophthalmic conferences and presented talks, paper, videos, wet labs, and live surgeries. So we welcome you, ma'am.
Thank you, Priya. Thank you. Thank you, Arshi.
Our next judge, Dr. Priya, can you please do the honor of introducing Dr.
So our
Aparna?
next judge is Dr. Aparna Rao, ma'am. She is consultant glaucoma services, Kallam Anji Reddy campus, Hyderabad. She was head glaucoma services in 2011 to 2023, LV Prasad Eye Institute, Bhubaneswar, India. She has completed PhD in molecular mechanism of trabecular meshwork cell death in adult glaucoma. She is member of Glaucoma Society of India, ARVO. She is reviewer for several peer reviewed journals and editorial board member BMC Ophthalmology, PLOS 1 in the IJO and clinical ophthalmology. She has a teaching experience, PhD train 3, 1 master train 16 residents or glaucoma fellows. We welcome you, ma'am.
I'd like to add here, ma'am was one of the main inspirations behind me taking up glaucoma. She's a beautiful teacher, and her interest in research is something that can inspire anyone to start finding out what the reason behind things is. Ma'am inspires all her students and all the optometrists as well to perform much better than they already do. And thank you so much, ma'am, for being a teacher and a clinician par excellence. Thank you for being here, ma'am. Dr. Karthikeyan, sir, could you please introduce our next dynamic judge?
Good evening, everyone. I'm going to introduce Dr. Preeti Kamdas. She's a glaucoma specialist from Mumbai. She's working at Dr. Kamdas Eye Clinic in Mumbai. It's a 100-year-old institute, and it's a center of excellence for glaucoma and retinal diseases. She was honored as a Woman Achiever in 2021 by Government of India under Beti Padhao, Beti Bachao initiative. She is invited as faculty for national and international ophthalmic conferences. Her teaching is a passion for her, and she is involved in teaching postgraduate students. She is a joint secretary of MOS, and she is a best journal member of Glaucoma Society of India. In 2024, she was honored by ACOIN for her work in the field of glaucoma. She conducts popular online courses in perimetry, OCT, and medical management in glaucoma. We are happy to have you, ma'am. Welcome.
A very warm welcome and thank you to all the judges. Before we move on to the moderators, I think, Arshi, we can have Dr. Satyan, sir.
Yes, ma'am.
Yes, because sir may have to leave. So we'll just want to, sir, to address. Can you just stop sharing the screen, Arshi, for a second?
Yes, ma'am.
Yes.
Satyan, sir, please, could we have some comments from you?
Yeah, wonderful evening. I'm so proud and I'm so happy to see all that bright and glittering Yosi members. I'm really happy to see all of you. And first of all, accept our hearty congratulations to Yosi. Such a wonderful organization now it has become, and you are reaching your really great heights. I wish you all reach much better heights, and you should be global. Okay, so that is the primary thing which I wish you all the best. And second thing is I want to wish all the Yosi members who are going to present today's the reels, the new norm probably. I thought I will be starting the first one, but you guys have started just before me. And hearty congratulations to all of you once again. And I wish all the candidates, whoever is doing their presentations, all the very best for you. And as we are going to start our World Glaucoma Week from 9th onwards, I wish more EOC members, you take up glaucoma as a specialty in your career, because 20% of the world glaucoma population, they live in India. So that is the magnitude which we are talking about today. can we all have our glaucoma patients treated properly so that we can kind of avoid needless blindness, especially this is an irreversible blindness. People are asymptomatic. So I wish more people of Yosi take up because you are our next generation. We wish many more people take up the field as a specialty, and then please do give our patients better quality of vision so that we can save the patient's eyesight. So with this few words, I know I can keep on talking, but I don't want to disturb because people are just waiting to do their presentation. All the very best, and once again, hearty congratulations to the entire team Yosi. Okay, thank you so much for
much,
the
sir.
opportunity to be with you today. Thank you all.
Thank you so much, sir,
Thank
for
you.
your kind words of encouragement. So, Dr. Karthikeyan.
Arshi, you're on mute. Yes.
Coming on to moderators, we have three young and dynamic moderators for this session. First is Dr. Archie Singh. She works as an associate professor in glaucoma services at Guru Nanak Eye Center, Mansi, New Delhi. She completed her MBBS from AIMS, New Delhi, and she was a gold medalist. She completed DNB ophthalmology from LV Prasad Institute, and she has completed FICO and specialty training in glaucoma services. She's an assistant editor in the Delhi Journal of Ophthalmology. She's a section in charge of DAWS Times and member of DAWS Young Surgeon Subcommittee. She's an executive member of Yosi. She's a team leader of Yosi Glaucoma Focus Group. And she's a managing editor of Yo Times. She has many publications in national and international journals of her repute. She presented at multiple conferences at state and national and even international level. Besides, ophthalmology holds a passion for music and reading. We welcome you, Dr. Arshi. Next we have Dr. Raki D. Cruz. She's a consultant and phaco surgeon at Ahalia Eye Institute, Kerala. She completed a short-term fellowship in medical retina at Comtrust Eye Hospitals, Kerala. She has over 13 research publications in national and international journals. She has more than 20 paper and poster presentation at state, national, and even international platforms. She won the Young Achiever Award from Women Ophthalmologic Society of India. She has a best free paper or section in community ophthalmology. She is currently as executive member of Kerala Ophthalmologic Society of Surgeons, and she's the president of Young Ophthalmologists of Kerala. Next we have Dr. Riya Sisodia. She's currently working as a cornea refractive surgeon in Retina Specialty Hospital at Indore. She has completed MS Ophthalmology at Gajraja Medical College. She completed her MBBS from Medical College Bhopal. She worked as a senior resident at Shivpur Medical College. She completed a fellow in cornea and refractive surgery from Madhya Pradesh. She has interest in dancing and badminton. We welcome you all.
So I think I'll move on to the introduction of the coordinators. So first we have our young dynamic Dr. Prasanna Venkatesh Ramesh. She needs no introduction. So he's the Joint Secretary of Yosi. He's currently the Research Director in Glaucoma here at Mahatma Hospital, Trichy. He's a DNB FAT examiner, coordinator. He's published 14 chapters, 52 PubMed Index journals. He is also on the editorial board member of the IGO. He's the Associate Editor of TNOA Journal of Ophthalmic Sciences and Research, and he's in the managing committee member of the TNOA. He's been a chief instructor at multiple courses at various international conferences. He has plethora of awards to his credit. So welcome, Dr. Prasanna, and he's been the key member, behind having this webinar. We had the season 1 last time, so that time also he guided us, and we did this together. And I'm so happy that he could join us today and help us coordinate this as well. So thank you, Dr. Prasanna.
Thank you for the opportunity.
Again, we have very, very, humble and very dynamic Dr. Karthikeyan, again participating for the second time in this glaucoma webinar. So Dr. Karthikeyan works as an assistant professor of ophthalmology at JIPMER, Puducherry. He's an ex-assistant professor at RPC AIMS, New Delhi. He's done his post-graduation and senior residency from RPC AIMS, New Delhi. He's got a lot of publications and presentations to his credit. He's one of the editor of the book Childhood Glaucoma, and which was published recently. And he has a lot of awards to his credit. It's for you to see on the screen. So thank you, Dr. Karthikeyan, again for helping us coordinate this. And this is me, Dr. Nupur. So I have completed my long-term fellowship from LV Prasad Eye Institute in comprehensive oculoplasty. I'm currently working as a consultant anterior segment and oculoplasty at Eye Care Eye Hospital and PG Institute, Noida. And this is me. So so that's it from all of us, the coordinators. Now, Arshi, over to you. Would you want to invite? Yes.
Welcome to all our coordinators. I would now request members of the Governing Council of Yosi, Dr. Divakant or Dr. Prasanna, to please kindly start our session so you can introduce us as well and Yosi as well. Thank you.
Thank you, Arshi. I would not want to be in between the session and the introduction. I'll just keep it quick. It's very happy and very heartwarming to see my mentor Satyan sir here. Maybe the question paper was leaked, sir. We knew the 7x7 was coming. So we just wanted to have it 2 days before for the YOs out here.
Yeah, looks like.
That was a sleeper cell, sir.
Prasanna, just sorry to interrupt you and the entire team waiting to do.
Yes, sir.
Just wanted to say that we are just in GSI. We are waiting for the Yosi to be part of our GSI. And I assure the Yosi is going to be there in the forthcoming GSI in September. So all the best. I think you people can rock it. All the best for today's and the future events to come.
Thank you so much, sir.
Once again, sir. So just to keep it short, so this was a brainchild of Dr. Nupur last year when we started this in a very small way as a glaucoma Gyan, and now we are seeing it grow to this extent where we have brought Satyan sir, Aparna Rao ma'am, Gauri Murthy ma'am, Vinita Ramnani ma'am, and Preeti ma'am. It's such a wonderful circle to have, and sir being on the other side, being my mentor again, it gives us immense joy. As Yosi is doing a lot of activities, the next coming reels by the participants and the art will speak for itself. And with that, the whole governing council and the team Yosi extends the congrats and, for all the participants for this heartwarming entry, for maximum entry that we have got so far for this kind of a competition. So with that, the event is open. Over to you, the organizers, to start the event.
Thank you so much, sir. So again, without further ado, let's begin this. Judges, please be ready with your mark sheets. So the first reel is going to be presented by Dr. Arut Priya. She's a consultant ophthalmologist with more than 10 years of expertise in advanced eye care services in glaucoma, cataract, neuroophthalmology, and also research. She's a current ophthalmologist at Sanvi Eye Care, Coimbatore. And education profile, she did her MBBS from JJM Medical College in Davangere and did her DNP in Lotus Eye Hospital, Coimbatore, and fellowship in glaucoma and research at Satyan Eye Care at Coimbatore. She has more than 15 research publications to her name. Welcome, Dr. Arut Priya. I'll go ahead and play her reel now.
What is the need of this awareness?
मैं उससे भी बड़ा साम्राज्य खड़ा करूंगा। May I come in?
Dr. Arut Priya, if I may invite you to unmute yourself and say a few words about your reel. And then I'll invite Dr. Dr. Aparna ma'am, Dr. Satyan sir, if he's there, to please give some comments about the same.
Good evening, all. Thank you for giving an opportunity to present my reel in this Yosi session. So, actually, I selected a movie theme because in olden days, in order to spread awareness about a particular disease, they used to perform dramas in the streets. So, we call it as Kuthu in Tamil. So, this mode of communication, I feel that it will reach even the uneducated people also. So, so many the every day the patients I see are most of them are come from a village, so they don't know what is the blindness also caused by glaucoma. So by this, and this movie is a famous movie. It's a pan-Indian movie. So because of with the base of this, I just want to spread the news that glaucoma is very dangerous disease like Narachi in KGF movie. So it will cause blindness if we don't treat in the early stage. So the shortest message I want to give is get tested, spread awareness, save the sight, and see the unseen. Thank you.
Over to our
Thank you so
judges.
much. Yeah, thank you so much, Arpiria. But it will be a bias if I'm going to give comments on my own student.
Student, yes, sir. Okay, sir. Dr. Aparna ma'am, Dr. Vinita ma'am, if you could say, because Dr. Satyan has a bias because she's been trained under him for glaucoma.
Yes, definitely. It's a very good way of educating people. And I think a movie has a lot of impact because it's not only visual, but then it connects to your brain faster. So well done. It's really good.
Thank you, ma'am.
Aparna ma'am.
Yeah, great thought process, because the way you have, highlighted the consultant as a hero, that's really great. But I think we consultants do not, we should not portray ourselves as a hero. We should just be the guiding light for the patients. Ultimately, the hero is the patient himself. So we are just the guiding light, but yes, great thought process, and the way you have portrayed it, very nice, superb.
Thank you,
ma'am. We'll move ahead to the second reel now. I think I'm having difficulty maneuvering again. So the second reel is to be presented by Dr. Devika Vasudevan, who is a primary DNB third-year resident at Shankar Eye Hospital, Coimbatore. She did her MBBS from JSS Medical College at Mysore and enjoys embroidery, photography, drawing, and playing basketball. So we'll play the reel now.
This is Bill. Bill was recently diagnosed with glaucoma. Bill exercises regularly, but he takes care to avoid heavy weight training and breathing out with closed mouth as they increase the intraocular pressure. Bill practices yoga and meditation, while he avoids head-down positions or inversions which lead to a sudden rise in intraocular pressure. Bill has incorporated lots of green leafy vegetables and food rich in antioxidants in his diet. Bill steers clear of smoking as it causes faster progression of glaucoma. Bill uses his eye drops at the prescribed time of the day with a gap between two different eye drops. He presses the inside corner of the eye for 2 minutes after instilling a drop. Bill accepts his disease and has made lifestyle changes to beat the progression of glaucoma. Bill is smart. Be like Bill. B-E, like Bill.
Dr. Devika, if you're here, if you could unmute yourself and describe your reel.
Good evening, everybody. I first of all would like to thank Yosi for this platform that you've provided me. In the event of this World Glaucoma Week that's extending from 9th of March till 15th of March, I've made this video mainly to like highlight the lifestyle modifications, and all these modifications will change, will help to bring down the control the progression and also increase the compliance of the patients. So this video is mainly directed to the OPD patients that have already been diagnosed with glaucoma and some of the lifestyle changes that we can suggest them. So, like we know how if the patient is not compliant and the fluctuations in IOP can lead to a faster progression in glaucoma in spite of using the drops, but at like wrong timings. And especially in the leafy and green leafy vegetables, it leads to the release of nitric oxide and helps increase the aqueous outflow and reduces the episcleral venous pressure. And meditation, as it is very well documented, that it helps in reducing the IOP and by increasing the endorphin levels and decreasing the cortisol levels. So my main aim is to help, like, use this video in OPD basis to help the patients that have been diagnosed.
Thank you, Dr. Devika. I invite Dr. Gauri ma'am and Dr. Satyan sir to please make comments on her video.
Yeah, Dr. Devika, very well made video, very well made reel rather. Congratulations. I particularly like the clear messaging. Okay, there is no confusion. It's very easy to understand and very simple layout, which doesn't clutter, which doesn't confuse. Very, very nicely conceived and very nicely made. Congratulations.
Thank you, ma'am.
Satyan sir, if you
Sir
hear.
has logged out, Ashi. We can take comments from Dr. Preeti ma'am this time.
Yes, Preeti ma'am, please.
So it was an amazing video. The creativity was great and exactly very clear concepts. And yeah, Bill is talking to you. The doctor talking to the patient doesn't really help. But if Bill and somebody like that can talk to the patients directly, it'll help so much. So congratulations, very well done.
Thank you.
I invite Dr. Priya to introduce our next speaker.
So our next speaker is Dr. Arun A. Sahi. He's showing art. So he is junior resident in ophthalmology, Jipmer, Pondicherry. Selectively extroverted eye doc trying to balance academic pursuits with personal life. So can we have his artwork?
Dr. Arun, can you unmute yourself and please talk about your art while it's being displayed?
Good evening, everyone. First of all, thank you, Yosi, for giving me this opportunity to present my
Dr. Arun, your network is cracking.
If you could come closer to the mic, that would really help.
So, now can you hear me?
Yes. I think in the interest of time, probably Dr. Priya, if you could give the explanation for the artwork that he's presented.
You can move on to the next slide, Arshi. The explanation is there. Priya can read it out. Yes.
Okay. So glaucoma is silent, but we shouldn't be. Glaucoma slowly steals sight without warning, making awareness and early detection the only way to fight back. This artwork visually captures the two sides of glaucoma. One where timely intervention preserves vision, and the other where neglect leads to irreversible blindness. The upper half of the image, filled with light, represent hope, awareness, and proactive eye care, showing people getting screened, undergoing treatment, and staying informed. In contrast, the lower half, shrouded in darkness, depicts vision loss, risk factors, and the silent progression of glaucoma. The central optic nerve shifts from healthy, normal cupping to damaged glaucomatous cupping, emphasizing how vision loss is irreversible once it sets in. With the message, examine, educate, and engage. This serves as a reminder that glaucoma doesn't give warnings, but we can. A simple eye exam can save someone's sight. Glaucoma is silent, but we shouldn't be. So this is very nice description.
If we could invite our judges, Dr. Priya.
Okay, so Dr. Preeti ma'am, you have any words to say?
So it's a beautiful presentation of the optic disc as the sun and the glaucomatous optic disc as darkness. Very well represented, and it's easier to make a digital one, but actually to draw, it's very difficult. We've left art and craft as a physical activity long back in school, but this was really nice. So Congratulations, Dr. Arun. Nicely done.
Dr. Satyan.
Dr. Satyan sir is not there. We can have Dr. Vinita ma'am give
Dr.
her
Vinita ma'am.
Yes, Dr. Arun, it is very well depicted. Otherwise well depicted, but it should be very wide and it should be visible widely. Like if you go on putting many things in a single message, I think that message gets diluted. So you have to give one strong message by art, but otherwise overall it was good.
Thank you, ma'am. Dr. Karthikeyan, sir, if you could introduce the next participant.
Our next participant is Dr. Glaucoma. He's a senior resident at Jitmar Pondicherry. Now we can show the next reel.
எந்த தொழிலையும் செய்யலாம் ஆனா அது ஒரு நேர்மை இருக்கணும். என்னடா அடிச்சிருவோமா? அடிச்சிர வேண்டியதான். நகரு.
As you see in this video, glaucoma is a silent thief of vision. It robs you of your vision silently and permanently, like how this guy is stealing coconuts while you continue doing your routine activities. So please get your intraocular pressure and fundus checked today.
Now we would invite the judges, Dr. Vinita and Dr. Gauri, to give your comments.
Dr. Karthikeyan, we can have first Dr. Gautam speak a few words about his reel and then we can invite the comments.
Good evening, everyone. As you have seen, I've used a famous Tamil comedy scene from a 1993 film to illustrate what glaucoma does to a patient. So many uncles and aunties from Tamil Nadu who are at risk for glaucoma will instantly recognize this scene, making the message more relatable and effective. So through humor, we hope to create awareness and encourage early detection. Thank you.
Judges, please.
Yeah, very, very, very nicely done. I like that silent thief of sight. He has taken that concept and he's taken the robber robbing the coconuts, the tender coconuts. Very, very nice. Okay, so I know you put that English thing for everybody to understand, but I think if you make the whole thing in Tamil for the audience, it'll be really nice. It'll be very, very nice.
I'm planning to do that for my Insta
Yeah,
page.
go ahead, do it, and share it widely.
Thank you.
Yeah. Dr. Aparna, ma'am.
I think even as Tamil film, if people know Tamil industry, these two comedians are very well known for their comedy in films, but even Sendil and Kaundamani, they're known as Sendil and Kaundamani. So I think Sendil and Kaundamani also would not have even fathomed that, their jokes and comedy reels would be presented and actually made sense of in this for glaucoma awareness. So I think hats off for such a great thought and a great way of presenting the entire message of how glaucoma is a silent thief of sight. Great.
Thank you.
Thank you so much. Dr. Prasanna, sir, if you could introduce the next participant for us.
Yes, Ashi. Thank you, Ashi, for the opportunity to introduce the dynamic John Davis Akara, sir, who has been, the guiding light for innovations for many people, including me. So John Davis Akara is a glaucoma, cataract, and refractive surgeon. He's also an ophthalmic innovator, eye engineer from Chaitanya Eye Hospital. Definitely looking forward to your video, John, sir.
Experiencing Visual Field Loss, Glasses, Apps, and Virtual Reality by Dr. John Davis Akara and Dr. Anju Kuriakos.
You have been diagnosed with glaucoma. That means that your optic nerve is damaged and your field of vision is poor.
But she's able to read till the last line.
Yes, yes. So that is different. But the problem is her side vision, her peripheral vision is lost. Let me just show you.
We can use a simple tool that we call glaucoma goggles. It is a regular pair of safety goggles with the periphery of the lens shaded out with black marker pen.
I'm not able to see the sides.
Correct.
I can only see the center.
We also have virtual reality vision simulators, which can be worn by the patient or attender to visualize how different severities of glaucoma can affect their peripheral vision.
If the glaucoma increases, then your vision field would reduce further. Now you can see that it is in severe visual field loss. Now back to normal. Why we need to understand what glaucoma is, and we need to treat the glaucoma so that your vision field is not reduced further.
Before we go to the judges, John sir, can you elaborate?
Yes, yes. So what we often see is when we try to explain to a patient a diagnosis of glaucoma, they keep saying, I can see everything. See, I'm able to read the last line. In fact, not the patient themselves, the attenders are the ones who are most confused. But my mom is able to read till the last line. Even I'm not able to read till the last line. Why do you say that she has a vision defect? So I find it difficult to talk to the patients and their attenders. So I use this app where you can actually see, we can actually show the live video and you can show what happens in various diseases, including glaucoma and ARMD, all those things. And that really helps. When you show that, then they start to understand, okay, this is what happens. So these sort of glaucoma goggles and these apps which help you to talk to the patients and their attenders, explain to them what exactly is happening to their vision, that helps in building a patient rapport and then helping to make them adherent to the treatment. So that is what is very important in glaucoma.
Thank you, sir. We'll take comment from the judges. Aparna ma'am and Preeti ma'am. Your comments, ma'am.
Yeah, what Dr. Davis has depicted is exactly what the attendant would be sitting next and reading. But she can read everything exactly what he said. And it's very difficult to convince patients, and this would be a wonderful way of convincing them that yes, you have a problem. The first acceptance is half the battle won, and then they will be motivated to start treatment. So well done, Dr. John. It was very nice.
One point, if I may add, Dr. John, it was a very nice video. And as Dr. Preeti pointed out, this is something that is every day what we face in the clinic. But then a glaucoma patient doesn't see black all around, okay? The brain fills up, okay? And many times patients with glaucoma say, no, that is not what I see. You don't, when they say tunnel vision, it's not black around and only small vision in the center. If that would be the case, everybody would come very, very early to us, okay? The brain fills up, and just like we don't perceive our blind spot, okay? We all have blind spots, but we cannot perceive that blind spot. So the same way, vision field loss due to glaucoma, even if it is very dense, is not perceived as a positive phenomenon by the patient. The brain fills in. So I don't know if you could have incorporated something. I mean, it is difficult to explain to the general public, I agree. But then you could have said that it's not like this, but then the brain fills up and it's just jargon there, nothing which is informative. And your information is absent for the whole thing. Think about it. If you can incorporate it in this reel, that will make it
right, ma'am.
better.
Now that AI has become very advanced, it is now possible to do an AI generated film.
Yes, do something like that. And that would be something that I would also use in my outpatient if you do that.
Right. I will do that, ma'am. I will do that. I'm using this for every patient. I just start telling them, see, this is your vision due to cataract, and this is your vision due to glaucoma. They're always worried about cataract. So I show them both.
Thank you, Dr. John and Dr. to the judges. Yeah, over to you, Arshi. Arshi, you're on mute. Yeah.
Yes, ma'am. I thought Dr. Rakhi has joined us. Rakhi, could you please take over and introduce the next participant?
So our next participant is Dr. Anju Kuriakos, who is a medical retina and uveitis specialist at Chaitanya Eye Hospital. And Anju is also a very good friend of mine. These two people always comes up with innovative and great ideas. So let's see what she has to present. It's an art. Let's see her art first. Anju, will you please try to...
Good evening to one and all present here. This is my art. I'm having it in my hand. Basically, this is made with an MDF board. I hope you can all see this. It is basically made with an MDF board. It is an I have used an sculpting and the painting technique to make it into a optic disc. I don't know whether it is an excavated part with this Monto texture painting. With texture painting, I have made it into a optic disc cupping excavation. In this, even with the patient who has low vision, can feel the dip and the bioniting and the RNFL defect area, which is shown as a thinned area compared to the rest of the area. So this is basically for the patients and for the counseling, basically for the patient counseling to feel and to have a tactile visual telling about this glaucoma.
Yeah, that was a great idea. So let's take the comments from our judges. Dr. Vinita ma'am, would you like to comment on her art?
Yes, it's very well made, and you made it 3D. And not only you made a disc, but then definitely you made an RFNL defect, which is very well seen. So that's a very early sign of a glaucoma. Very well depicted so that patient can understand. Thank you very much. It's very well.
Feel about it
And
also.
feel.
Dr. Aparna ma'am, your comments on Anju's art, please.
So, this tactile thing is very, very innovative, and really appreciate that you have made this, crafted this, and thought of it so well to educate your patients. But I would also like that, along with the 3D thing, what is more important is to show how that will change over time if that if they are not regular with the drops, and what we aim with the treatment. So that is what is the most important for them to understand, that okay, this is how it looks at present, but for them to understand about the importance of regular medicines, regular review, I think it will be good if you could incorporate and also teach them that if this is the picture, this is how it will become, and this is how the field becomes because of what happens to the disc. So that will be very, very innovative for the patients to understand.
Sure,
And
sure,
that,
ma'am. Maybe I
yeah.
can do a series of things to keep it for the
Yes.
counseling.
Yes. Great work.
Thank you,
Great
ma'am.
idea.
Thank you, Dr. Anju. We can have the next participant, who is Dr. Manju M. She did her DO and DNB and FAEH in glaucoma and MRCS from Edinburgh. She's working as a consultant ophthalmologist and glaucoma specialist at Arya Eye Care in Thrissur, Kerala. And Dr. Manju's reel is...
Let's prioritize eye health, conquer glaucoma, and see the future with clarity.
Thank you so much, Dr. Manju. Can we have you unmute yourself and have your video?
Thank you, Yosi, for this opportunity. And we have named this reel as a race of vision. Actually, through this reel, we wanted to visualize glaucoma as a competitor in a race against their patient. And at each checkpoint, like IOP check, optic nerve evaluation, HFA, OCT, and the treatment, glaucoma slows down and finally stops. So what we wanted to incorporate is the time factor. So basically, as a race, we are incorporating the time factor of in glaucoma treatment, like early detection, regular eye checkup, and the timely treatment. So the message is clear: don't let glaucoma hold you back. See the future clearly. Thank you.
Thank you, Dr. Manju. Dr. Preeti ma'am and Dr. Vinita ma'am, if we could have your comments.
Superbly done. It was so nice. In 2 minutes, you could convey so much. But only thing is, I wanted to say is this ONH, VF, these are doctor terms. We are making this for patients. So maybe you could just term it a little differently, something which a patient or a common man would understand. But otherwise, it was a very well made film. It was so entertaining.
Thank you.
Gauri ma'am. Vinita ma'am, please, can we have your comments?
Yeah, it is very nicely made, but then probably it was a monotonous, like nobody can understand every time that run was there. So my suggestion is like instead of having that eye, you can have different pictures coming in so that as Preeti said, that it is understandable to everyone. Otherwise, it was a nice concept.
The concept is nice, but as Dr. Preeti and Dr. Vinita mentioned, people will not know those short forms. And a better way of doing that is like, you don't have the whole picture and each test uncovers a part of it for you. And finally, you know whether you have glaucoma or not. And, you have, detecting is half the battle or more than half the battle one. So use that. I mean, I get your concept. It's a nice one. So rather than a race, I was just thinking it's like a puzzle and it's all covered up. So with each test, you are uncovering a portion of the puzzle. Okay. And once it's out, then it's once you know the enemy, you can fight the enemy, right? So that.
Thank
you. Very beautiful concept explained, Dr. Gauri. Dr. Raki, if you could take over for the next speaker.
So our next speaker here is Dr. Megha. She is another dynamic participant. She participates in most of the Yosi programs, and she has done her glaucoma fellowship at Arvind Eye Hospital, Pondicherry, and currently working as a consultant at Arvind Eye Hospital, Salem. So let's see her reel. It will be always something like catchy and innovative.
I have a query from a patient. Hello doctor, I have glaucoma. I am using my eye drops regularly. What else can I do to control my glaucoma? Here are the tips you can do to better manage your glaucoma along with using your drops regularly. 4 things to do. Tip number 1, meditation. Practicing mindfulness meditation will help your glaucoma. Tip number 2, maintain proper diet. Have nutritious foods like vegetables, nuts, moderate amount of fruits and foods which are rich in omega-3 fatty acids and antioxidants as well. Tip number 3, exercise. Moderate amount of regular exercise or yoga helps decrease your eye pressure. Tip number 4, intermittent fasting or decreasing your calorie intake. 4 things to avoid. 1, stress. Find an activity you enjoy which gives you peace of mind. 2, extreme exercises like Shirsasana, Sarvangasana, Halasana and few other breath holding exercises can cause increased eye pressure. Number 3, quit smoking. Number 4, decrease your caffeine and alcohol intake. Thank you.
So her reel was again on lifestyle modification. Now we would like to hear from you, Megha, about your reel.
Yeah, thank you, Yosi, for the opportunity. As the reel itself depicts, the small short video of 2 minutes, I just wanted to show many of our patients are telling, I'm using my drops regularly. What else can I do? So we are usually, no, you cannot do anything else. But only thing is to use the drops regularly. So at such a point, I feel just showing this short video of 2 minutes is going to help them a lot. Not only for the patients, but also to educate the doctors, wherein most of us are at loss of telling what else we can do. So this being Women's Day, I also, the pictures of yoga are my mother's. So I thought I would incorporate her picture also, as she's very active even at 60-year-old. So as a video directly depicts, I just wanted to show a few things which the patient can do other than using the drops regularly. Thank you.
Thank you. So let's take comment from our judges, Dr. Aparna ma'am. So what is your take on her reel? And I remember that you had also published a paper on certain exercises, yoga exercises, which can actually cause the progression of glaucoma. So if we tell the patients do exercise and yoga, they'll start doing all sort of exercises. So what is your comment on this?
Yeah, I mean, it's good that she has put in effort into educating the patient about yoga. No doubt that yoga is a science in itself, and there are lots of diseases that we as allopathic doctors do not know but can be treated with yoga on long term. But for glaucoma, like you correctly said, we have to remember and be aware of what happens when we term yoga. Yoga means actually is a very gradual and a very disciplined, uh, customized treatment for each and every individual. It's not the same for everyone. So when we tell that to the patient that yoga is beneficial, it has to be told cautiously, ensuring that the effect of unsupervised yoga, for example, I would say that many often patients do water drinking for early in the morning, drinking 2 liters or 1 liter of water. They do Shirshasana, that is not recommended. They do a lot of exercises like which compress the stomach, which will increase the JVP, and therefore that will increase the intraocular pressure. So, any kind of sudden increase in the intra-abdominal pressure, which is going to be sustained for a long term, or which is going to increase the blood flow to the head region, now, those exercises are actually going to increase the IOP, and that is why whenever I tell my patients, I often tell them that you can do Alom Vilom. Those you can do, but the rest of the exercises, I'm not an expert. Please have a yoga instructor to tell you what exercises are beneficial and what exercises you should avoid when you have glaucoma. Because really speaking, I'm not an expert to understand whether a particular exercise has any effect on the eye or the intraocular pressure. But yes, if there is an increase in the JVP which is going to be sustained, you can expect the intraocular pressure, and the studies do show that certain positions do increase the intraocular pressure. So that I think it's good that she has given the message of meditation and yoga for glaucoma patients, which I think is very, very useful. But at the same time, you have to be cautioned about unsupervised yoga.
Thank you, ma'am. Dr. Gauri, ma'am, your comments on Mega's reel.
Yeah, it's a nice reel, but only thing is, few of these things are a little, not scientifically very proven. Like Dr. Aparna said, exercise in general, yes. There are lot of papers which show that aerobic exercise, increasing blood flow in any form, helps in glaucoma. And when you say yoga, you should always qualify that the Shirsasana and the head down positions are to be avoided. So you can give a disclaimer saying check with your, instructor before doing it, but do it. Any form of physical activity is good. So, and also these forcible breathing like Kapalabhati and Bhastrika Pranayama, those are very much like a blowing wind instrument. So that can increase your eye pressure. So a big disclaimer when you're talking about yoga per se. Okay. And the other things are all very good, Dr. Megha. This is something that everybody asks, what else can I do? So instead of saying nothing else, to say all these things is quite a, nice thing. Very nicely done.
Thank you.
I want to add a comment that Megha, you can add that control your blood pressure, control your weight, diabetes, heart problem, because there are so many other non-IOP related factors which are responsible for the progression of the disease, especially in NTG patients. So I think we can add on those systemic illnesses which affects the glaucoma progression.
True, true. Yes, ma'am. That I'll try to add it up. Thank you, ma'am.
Thank you, ma'am. Dr. Priya?
So our next participant is Dr. Deepika Biraka. She is medical officer in Arvind Eye Hospital, Madurai. So let's have a art. Dr. Deepika, can you unmute yourself
Yes.
and please explain about your art?
Good evening, everyone. Firstly, I would like to thank the entire team of Yosi for giving me this opportunity to present my art. This is a simple yet a powerful illustration for a glaucoma awareness week. In the picture, we see a hand reaching out from the damaged optic nerve, emerging from darkness into the light. It symbolizes the struggle against the glaucoma-induced blindness and the hope that comes with the timely intervention. In the surrounding hands labeled regular eye checkups, eye care awareness and early diagnosis, represents the support and the preventive measures needed to fight this condition. And with glaucoma being a leading cause of irreversible blindness, a silent thief accounting for 8% of blindness globally, the slogan Uniting for Glaucoma Free World calls for collective action to raise awareness, promote screening, and to protect vision for future generations, creating a world where glaucoma is not a significant threat. Thank you.
So thank you, Deepika. Dr. Ma'am, any comments from your side?
You asked me because I lost.
Okay, ma'am.
So it's like this that we are assuming that patients know how an optic nerve looks. So it's a beautiful illustration and very powerful. But only thing is when I look at it, suppose I didn't know what glaucoma is. If I was not an ophthalmologist, would I understand where the hand is coming from? Okay, I probably would not. And even the letters, I mean, say diagnosis, all that is not very clear. So the message is very powerful, but and the thought process is amazing, and what you have drawn is, but maybe it needs a little bit more clarity, and we are assuming that patients know what the optic nerve is. Where is the hand
Yes,
coming
ma'am.
out from? You know, that's right. But it's very beautifully done. Very
Thank you, ma'am.
powerful concept.
Thank you, ma'am. Dr. Vinita, ma'am, comments from your side?
Yes, it is nicely represented, and it's difficult to make the art and express your feelings. Like you can express your feelings more through the reels, videos, the verbal things. But depicting is really good because everybody knows that glaucoma disc, like the first one we saw the disc on a that rounded shape and then 3D view. The same thing, like it depicts, but yes, very well depicted and nicely made it. Only thing is, as Dr. Preeti said, make it little more elaborate, and when the hands it's written,
Yes,
it should
ma'am.
be very clearly written. Otherwise, nicely made.
Thank you.
Thank you so much, judges. That was a very artistic image, actually. And the next speakers, Dr. Karthikeyan, sir, please. Okay.
Our next speaker, next participant is Dr. Mehak Gupta. She is currently doing post-graduation at Guru Nanak Eye Center, Mansi, New Delhi. We'll move on to her.
Dr. Mehak, if you could just talk about your reel.
Thank you everyone for giving me the opportunity. Through this reel, I want to highlight the importance of correct way of putting eye drops in the eyes, and also the importance of regular follow-ups. Because if patient puts eye drops in an incorrect way, it leads to wastage of drug and also systemic side effects. Thank you.
I will invite Dr. Aparna and Dr. Preeti to give your valuable comments, ma'am.
Yeah, very nice and very simple, but very impactful messages. The one thing you have correctly mentioned about the way of instilling drops and the other informations that we normally want to give our patients, and this will be very useful if you can run this video in the waiting halls while the patients are waiting to see you. So it will be very useful for those those kind of scenarios. But the one thing that is important, remember, is also the regular discussion with the physician. So 3 hours are very important in glaucoma. Regular treatment, regular review, but also the regular discussion with the consultant. So in that way, if you also highlight some steps of how you need to discuss with the consultant about any kind of problems regarding the drops or anything, that is always crucial in maintaining the adherence and the compliance to the treatment regimen in a long term.
Okay, ma'am.
Again, everybody is so good, and this was again amazing. But I only felt that the chronology can be different. I mean, I felt they could be completely two different reels. One is on how to use eye drops, and second was on diagnosis. I mean, combining the two, I felt the message is not going very clearly. So if you can even divide it into two, it will be two separate, independent, beautiful reels. But very well done. So each reel, each half gave the message very well. Another thing is you're using human subjects. So maybe some disclaimer like that you have taken the permission of that person to be displayed, his face to be displayed in a reel. Maybe that is can be added, it helps.
Okay, ma'am.
So judges, I would just like to make a comment here. What I really like about this, webinar, you have a postgraduate student and a consultant, all of them, making an attempt to make reels. So I think that is something very laudable, that, all of them have come together and try to participate. So I think that's a huge, it's very heartwarming to see that. Yes. Over to you, Arshi. You're on mute. You're on mute, Arshi. Manjula, can we unmute Dr. Arshi?
I did, ma'am. I'm sorry. I just
No
seem to
worries.
get lost sometimes in Zoom.
No worries.
Just as a breather, we have the introduction of the glaucoma focus group, giving an important message to all the patients. So the main thing is that we all united together, residents or consultants, to spread awareness about this disease and to prevent any loss of vision that the patients might occur by spreading awareness. Over to you for the next introduction of the reel.
Thank you, Arshi, for again such a wonderful, innovative webinar and the opportunity. So next, I would like to call upon Dr. Navyashri GV, who's a second-year postgraduate from Karnataka, and she's on a journey to master the delicate balance between vision and care, eager to explore uncharted territories and grow with every challenge. Over to you, Dr. Navya.
Grand good evening to everyone.
Dr.
Am I
Navya, a few
audible?
words.
Yes, you're audible.
A grand good evening to everyone, respected teachers and all the judges. I would like to start my talk with a quote that says, "Srishti Prakriti Samvedanam, Jeevanasya Saundaryam
Dr.
Darshayati."
Navya, there's a lot of disturbance at your end.
Am I audible now, ma'am? Is it clear? I'm very sorry.
You're audible, doctor, but we are just not
Somebody
able to
is
hear you
talking in the
clearly.
background.
Yes, sir, because there's no network in my college. And there's a lot of problem. I'm very sorry for that.
No issues. We'll take the judge's comment if that's okay with you.
No,
Preeti,
sir, I want to.
Yeah, you can come little closer to your device and speak. Yes.
Yes, ma'am. Okay, so I want to start with a quote which says, "Drishti Prakriti Samvedanam, Jeevanasya Saundaryam Darshayati," which means vision perceives the essence of nature, revealing the beauty of life. Since it said creative wheel competition, and I am a photographer and a videographer, so I try to combine my passion with my profession. And glaucoma in many ways mirrors nature's delicate balance. And patients might not know what a colored halo or a blurred vision. They might think it's not something normal. So I felt this pictorial image might be more impactful and it might reach the crowd. And and the connection is clear in both nature and eye. Innovation can restore harmony. With new treatment and cutting edge technology, we can nurture the vision ecosystem. Thanks to Yosi team for giving this opportunity, and thanks to Nupur ma'am for tolerating all my questions. Thank you so much.
thank you. Thank you, Dr. Navya. We'll take comments from Vinita ma'am and Gauri ma'am.
Yes, sir.
Nice concept, Dr. Navya, but I was more involved into seeing the scenic beauties which was there behind, and the message I was not able to get into. So I request that you can reframe it and putting little more efforts of giving the message of glaucoma, I think, more clearer. Thank you so much.
I second what Dr. Vinita said. Exactly. The imagery is good, but the messaging is not very clear. Thank you.
Arshi, over to the next.
I'm just checking again.
Yeah.
Dr. Rakhi?
Rakhi, are you there?
Yes, yes.
Yeah.
So again, we have an entry from Dr. Megha, who is working at Aravind Eye Hospital, Salem. So this is an artwork which he had submitted. It is showing a colorful rangoli on how eye pressure affects the optic nerve. So Dr. Megha, would you like to describe your art here?
Yeah, so as a part of the Glaucoma Awareness Week, we as a team had we've done this rangoli at the entrance. So and we've kept charts beside this so that once the general public is attracted towards the rangoli, and then they'll come about and see what exactly is glaucoma and what is going on. So since the rangoli was made so colorfully and so beautifully, I thought I'll share that as my artwork here. And then just because of the rangoli, many other, all those people, they could come, and we have placed nursing staff there so that they can explain about what exactly is glaucoma and about its awareness.
So thank you. Now we would like to take comments from Dr. Preeti ma'am. Preeti ma'am, your comments on this artwork.
Rangolis are difficult to do. There is no doubt about it. It takes a special skill to do rangolis. But again, I always say that we are talking as if the patient is an ophthalmologist. The patient does not understand the structure of the eye and the pressure and other things. So it was a nice idea that once a person gets attracted by the rangoli, he'll be counseled. He or she will be counseled. So that's a nice concept. And the rangoli is beautifully done, but it could be made better in the terms of that patients in one look can understand what it is depicting. But as I said, very well done.
Thank you,
ma'am.
thank you. Maybe for the next week, I'll change it to that.
Yes, that.
Dr. Aparna ma'am, your comments on her artwork. Dr. Aparna ma'am.
I think I'm not an expert in rangolis, but I can just enjoy the beauty because I do understand art, but I'm not an expert in rangoli. But yes, again, portraying the message of glaucoma in a rangoli is indeed very innovative
Thank you, ma'am. Thank you.
and appreciate again
Okay.
young presenters. I mean, really portray all this.
I just put a comment, and last year GSI at Puducherry, they made a beautiful rangoli of glaucoma. So it's eye-catching, and it just has an impact that there is something. And rangoli being a traditional art of ours, so being connected to our eyes and heart and soul, everything. Thank you. Nicely made.
Thank you. Thank you so much, ma'am.
So the next participant is Dr. Neriha Rashid. She's a second-year MS resident at Arvind Eye Hospital, Madurai, and an aspiring glaucoma specialist. Dr. Neha, could you please describe your art?
Actually, Dr. Neha could not join us today due to some family emergency. If you could just go to the next slide and read her description.
Yes. All the judges, please take a note of her artwork. She says this is regarding the importance of compliance of medication. With regular medicines and follow-up, it's far easier to control the progression of the disease, but failure to do so can lead to a tunnel vision. Everyone has two choices. The picture depicts what that choice could lead to. Let's go back to the image once again so the judges can see it again. No medication, and with medication, choose whether it's the bright side or the dark side. Over to our judges for their comments. I invite Dr. Preeti ma'am to please say a few comments about this art form.
Dr. Neha is a good artist. That's what comes across first. I mean, it's very nicely done. And of course, yes, in a very hard-hitting, simple message that with treatment, you can prevent blindness, and without treatment, you will lose vision. So I like the concept, of very clear concept. That's what's the beauty of this artwork. One single hard-hitting message.
Thank you, ma'am. Dr. Gauri?
It's a nice concept and nicely portrayed also. It's good. It's very difficult to convey everything in a single artwork. So one particular concept is being conveyed, and I think it's a good attempt. Very nice.
Thank you so much, ma'am. So let's move on to the next. Dr. Priya?
Okay, so our next participation is Dr. Shobna Yu, and she is currently in second year MS Ophthalmology from Arvind Eye Hospital, Madurai. So can we have her read? Dr. Shobna, can you please unmute yourself?
Dr. Shobna, please talk about your read.
Yes, ma'am. Good evening, everyone. Good evening, judges. And I thank Yosi team for giving me this opportunity. I have made this video to emphasize the importance of family screening in glaucoma. As we can see in this video, it is from the son's point of view. In the initial part of the video, we can observe that his peripheral field is slightly constricted. However, since the patient had no noticeable symptoms, we ignored the doctor's advice, and it was only after many months following the accident, where he had complete tubular vision, he noted that something was wrong with him and he came for examination. This can be relatable to our daily OPD practice, where we can come across many patients with strong family history of glaucoma who have no symptoms and are diagnosed only when they present for routine checkups or with advanced diseases. So, unfortunately, many people are still unaware of the importance of screening their family members. This realization struck me while observing our glaucoma department, where we had dedicated staff to monitor patients and counsel them about family screening. They play a crucial role in educating patients about the increased risk in first degree relatives, siblings of glaucoma patients, and offspring of glaucoma patients. So, the short message is that early detection and timely treatment are key to preventing visual loss by identifying at-risk family members and ensuring whether they undergo regular eye checkups. We can significantly reduce the burden of undiagnosed glaucoma. Thank you.
Thank you, Dr. Shobna. So let's have comment from Dr. Vinita ma'am.
Yes, Shobna, very well depicted. Like as we were saying, that when you pass on a message, it has to be very clear. So it goes to the uneducated patients, which are not doctors. So I think this video depicts that if they don't get the treatment, they may have an chances of more accident because of the fields getting restricted. So very well done. Thank you so much.
Thank you.
Thank you, ma'am. Dr. Gauri ma'am, any comments from your side? Okay. Dr. Preeti ma'am, any comments?
I loved it. I mean, the music and even the portrayal was so powerful. The only thing I have is that, of course, we are global citizens, and your reel may reach somewhere in Europe also. But it would be safe to assume that first it will reach an Indian. So use Indian faces, Indian roads, Indian hospitals. It will relate more with the patient, with the person who you're trying to educate. But it was superb, very nice.
Thank you so much.
Gauri ma'am, yeah, if you can also give your comment.
Yeah, I think I agree with what Dr. Preeti said. Very nice idea, very nice execution, but Indian faces would be even more better. I mean, nicer. That's all. Very nicely done. It's very easy to criticize, huh? Very difficult to do. All of them have done a very good job.
Thank you, ma'am. So next we have Dr. Neha Rashid. So we can just play her reel. Yes. So I think that was a very nice attempt by Dr. Neha. Dr. Neha again could not join us, as I mentioned today. So over to judges' comments. So Dr. Vinita ma'am, comments from you.
Yes, nicely made. The same way that with medication and without medication, what will happen. But then the impact of that art was much, much stronger than this. So it could have been even better. But yes, nice attempt.
Thank you, ma'am. Dr. Aparna ma'am.
Yeah, this is easy to convey to our community patients who are not that educated for them to understand the importance of medications and to ensure compliance. So yes, very nice way. At least for those, it can even be kept in their, as a message or whatever with the appointment. This is a very good picture that you can send as a reminder for them to put the medicines. Very nice.
Thank you, judges. Over to you, Dr. Karthik and Rashi.
I would welcome the next participant, Dr. Niyati Unial. She is doing her pursuing glaucoma fellowship at Shroff Charity Eye Hospital. Over to you, Dr. Niyati.
Good evening, everyone. Am I audible?
Yes, you are audible.
Good evening, everyone, and thank you for this wonderful opportunity. This art represents my view of glaucoma. The black and white photograph of an eye represents the silent and often unnoticed progression of glaucoma, and a colored fundus image is a glimpse into the optic nerve and RNFL, which is most affected part. Glaucoma, the silent killer, denotes that the disease is often asymptomatic until significant damage has occurred. But there is a hope emphasized in the tagline, early detection and lifelong vision. This image is not just a warning, it is a call to action. Let this be a reminder that awareness, education, and proactive care are our strongest tool in the fight against blindness. Thank you.
Now, over to you, judges. Vinita ma'am and Gauri ma'am, your comments, please.
Yeah, again, this for the general public, this doesn't make too much sense because that picture of the optic nerve and the retina and the blackened face, it's you can explain it, but it doesn't come out as a very coherent, striking message. So concept is okay, but I feel you can think about other ways to convey it.
Nicely made. It catches your eye, but understanding part is a bit difficult. So what we can do is we can incorporate certain words into it so that it can depict any change or whatever way you want to explain it. Otherwise, nice concept, and it could be a poster like when you put it like as a glaucoma clinic. Thank you.
Neeti ma'am, your comments?
The same what Dr. Gauri and Dr. Vinita has said, that it looks beautiful, but does it convey in one glance what a patient would, we can make out because we are ophthalmologists. So you have to think when a person doesn't know what glaucoma is, when he looks at that picture, what does the person see? He will say it's beautifully done, but he will not know. That person will not know what it is trying to depict. So beautiful work, but maybe something to add, something you will need to add to make the person realize what you're talking about. You have written silent killer. Killer of what? It can be heart, it can be your eye, it can be anything. So we have to think from a patient's point of view who doesn't know what glaucoma is. Yeah, but it was very eye-catching, very nice.
Thank you so much. We'll move on to the next participant now. Over to you, Prasanna, sir.
Yes, Arshi. So next we have Dr. Varsha Chauhan, who's a second year junior resident from Pune. Over to you, Dr. Varsha, for your reel.
लेफ्ट आई में कांच दोनों में ही था, पर लेफ्ट आई में पूरी रोशनी कम हो गई।
तो हुआ है ग्लोकोमा, यानी काला मोतिया या गाज बिंदु। ये आंख का बीमारी जानना चाहते हो? क्या है इसके बारे में जानना चाहते हैं। ठीक है, चलो बताते हैं।
हमारा जो हड्डी होता है वो तो बढ़ता नहीं है, हड्डी उतना का उतना ही है, पर जो प्रेशर है उसकी वजह से जो टिश्यू है वो बढ़ता जाता है और पीछे की नस को सुखाता जाता है, तो जिसकी वजह से आपकी देखने की शक्ति कम हो जाती है। ठीक है, तो इसलिए हमेशा क्या करना है, जो भी 40 साल से ऊपर है, ठीक है, उनमें ये रिस्क ज्यादा होता है। दूसरा, या तो जिनकी फैमिली हिस्ट्री में ग्लॉकोमा है और कोई चोट लग जाना, उसमें ग्लॉकोमा के चांसेस ज्यादा होते हैं। ठीक है, रूटीन चेकअप कराना है। अगर आप 40 साल से ऊपर हैं तो एक प्रेशर चेक कराते हैं। दूसरी चीज होती है पीछे की नस का इमेजिंग, क्योंकि ओसीडी है, ओसीडी आरएनएफएल बोलते हैं उसमें, तो आपको टाइमली इसमें क्या है ड्रॉप डालने होते हैं। तो वो कंप्लायंस जो होता है कि पेशेंट डाले, हम तो बता सकते हैं, आपको खुद से डालना है, तो आपकी जिम्मेदारी है। अगर वो पेशेंट को हमने बता दिया और उसने डाला नहीं तो ग्लॉकोमा ट्रीट नहीं होगा, उसका प्रेशर बढ़ा रहेगा और उसकी नस सूखती रहेगी। ठीक है, और फिर वो देखने में धीरे धीरे कम हो जाएगा। तो वैसे भी प्रेशर कंट्रोल नहीं होता, उसमें सर्जरी करते हैं। ठीक है, तो वो हम बताते हैं, फिर आपको फॉलोअप पे आना पड़ता है, आपका विजुअल फील्ड टेस्ट होता है, प्रेशर चेक होता है, तो उसके लिए आपको हर महीने, हर 3 महीने या हर 6 महीने वो हम पेशेंट को बताते हैं, उस तरीके से आपको आना होगा।
ये बड़ी अच्छी बात कही है।
Thank
Yeah, Dr. Varsha, you can unmute yourself and describe your reel.
Ma'am, am I audible?
Yeah, you're audible.
A very good evening to all. So, my idea behind creating this reel was to create awareness about glaucoma among my patients and among general public regarding what it is, what are the risk factors, how it is diagnosed, and lastly, how it is managed, starting with the anti-glaucoma medications, how it is to be administered, and the importance of timely administration of these drops, and the available surgical options and the follow-up. So, I wanted to highlight the message that the main way to prevent blindness from glaucoma is by early detection and diagnosis. And to do so, awareness must be raised among people to see the future clearly. So, I'm really grateful to Yosi for providing this wonderful opportunity to us. Thank you so much.
Thank you, Dr. Varsha. I would like to invite comments from Aparna ma'am.
Aparna ma'am.
Aparna ma'am and Vinita ma'am.
Dr. Aparna has just messaged that her net is breaking, so we can take comments from Vinita ma'am.
It is nice way we all do it in our patients. I have a glaucoma support and care group, and I collect my patients and give this kind of information. And I think interacting directly one-to-one by a doctor creates a good message. So I think this video has a clear message that what should be done and who are at risk and what we should do when the good, nice concept.
Thank you. In the interest of time, Arshi, I think we can move on to the next presentation.
Yes, ma'am.
Yeah.
The next presenter, please, Priya, can you take on?
So our next presenter is Dr. Manushri Gautam. She's assistant professor in MGM Medical College, Indore. So can we have her read?
ग्लोकोमा जिससे हम अक्सर आँख चुराते हैं और वो हमारी नज़र ही चुरा लेता है। आज हम आपके लिए लाए हैं ग्लोकोमा की कहानी, उसको जीने वालों की जुबानी।
Did the reel come through clearly? Because I had it very broken on my end.
Yes.
I think I'll just play it once again.
Yeah, just play
This
it.
time it's going to be a little better.
ग्लोकोमा जिससे हम अक्सर आँख चुराते हैं और वो हमारी नज़र ही चुरा लेता है। आज हम आपके लिए लाए हैं ग्लोकोमा की कहानी, उसको जीने वालों की जुबानी।
I think, Manushri, your video has not come through. So what we'll do, can you present it from your end? Do you have it as a backup?
Yes, ma'am, I'll try.
Can you try? Yeah. So till then, we can move on to the next participant till you are working with your technicalities. Yeah. Yeah. Okay. So next we have Dr. Shweta Singh Punia. So judges will come to this Dr. Manushri's reel again. Priya, I want you to mute yourself, please. There's a lot of disturbance from your device. So Dr. Shweta Singh Punia has done her MBBS from Mahatma Gandhi Medical College, Jaipur, and currently she's doing a post-graduation from SMS Medical College, Jaipur, Rajasthan. So this is Dr. Shweta's artwork. And Dr. Shweta, can you unmute yourself and describe your artwork, please?
Hello, everyone. Am I audible?
Yes, you are, Dr. Shweta. If you can turn on your
Thank you,
video
ma'am.
also, that would be great. Yeah.
Thank you, ma'am. Just wait a second.
No worries.
Ma'am, yeah, my network is not so strong. I'm so sorry.
No worries.
I would like to describe my. Can we have the art back? Yes. Thank you, ma'am. As we all know, the theme of this year's Glaucoma Week is to see the world clearly. And for creating the awareness for the same, I've made a canvas art. Basically, we have to create awareness among common people. So I thought the visual should be something which leaves an impact directly on people's mind. This art shows how to behold the wonders of the world and not let glaucoma hinder your vision. With this art, I wanted to illustrate how glaucoma affect people's ability to see the world, just like this girl standing in darkness, which is basically the tunnel vision as the symptom for most of the people, although for not all, which we as a ophthalmologist are well aware of, but not the common people. Here, I want to add that we as ophthalmologists know that there are many symptoms of glaucoma, but here only one could be used as not all can be conveyed in a single art. So I've tried to show that this girl standing in the darkness, it's like standing at a locked door, and through that, a glimpse of colorful world can be seen. And if she wants to enjoy this colorful world, she needs to open this locked door with the key, which is mainly the early diagnosis and seeking treatment for the same. And then she can enjoy living in the colorful world to the fullest. Lastly, I would like to say the art should speak for itself, and that's why I've made this simple yet impactful art so that people of all age can understand and become well aware. Thank you.
Thank you, Dr. Shweta. That was a beautiful artwork from you. So can we have comments from our judges? Dr. Preeti ma'am, what do you have to say about your beautiful artwork?
Again, as I said, she's a wonderful artist, and an artist thinks so much in depth. But I did not think that what she had in her mind, like the girl standing in darkness. To me, the girl was not standing in darkness. She was standing in bright light and enjoying the beautiful colors that you have painted. So it was a nice concept. Your thought process was very good, but maybe an artist thinks differently and a common man would think differently. So, in one glance, if I didn't know what glaucoma was, I would have to really think that, can you explain it to me? The creation should be self-explanatory, but very well done.
Thank you, ma'am. Thank you, ma'am. Dr. Preeti ma'am. Dr. Gauri ma'am, what do you have to say about her?
Yeah, same as what Dr. Preeti said. It's very difficult to depict all the aspects through art, but a little more coherent messaging would be very nice. Beautiful art. No problem.
Thank you. Thank you. We now have the reel by Dr. Manushri. Dr. Manushri, you can play it, please. Yes. Manushri, the audio is not coming. I think you forgot to share the audio. Can you share it again?
In your Zoom option, just click on share audio as well. Go back to screen share.
Stop sharing the screen. Share the screen and click on the share audio button, and then you go on to the video. Manjula, can you be able to help us with this? Sharing, if I share the video with you on WhatsApp?
Send it to me, doctor.
Yeah, I'm sending it to you.
Ma'am, in the interest of time, and our judges' time is very precious, ma'am, if you don't mind, we can move ahead with the glaucoma Gyan lecture.
Yes,
and judges, we could come back to the last reel the moment the first lecture is done or when the presenter is ready. So this is a very concept that we have started, which is Glaucoma Gyan, in which we invite young ophthalmologists who specialize in glaucoma to give their opinions and talks on a topic of interest. So today we invite Dr. Reenal Pandit, MBBS MS Gold Medalist, Consultant Glaucoma Services at Choitram Netralaya at Indore, who is a proud alumnus of Shankar Netralaya, Chennai, passionate towards academics as well as research. She has 21 peer-reviewed publications and is the winner of IGO Platinum Award, and also has the prestigious CRST International Photo Contest 2023 award under her belt. She does a lot of things with AI applications in glaucoma management. Over to you, Dr. Reenal.
Good evening, everyone. Thank you, Team Yosi, especially Dr. Arshi and Dr. Prasanna, for your kind invitation. It's a privilege to be a part of this webinar and share my glaucoma Gyan with you all. Just give me a moment to share my screen, please. Can you just stop your screen sharing at your end so that I can start mine?
I've already stopped mine.
Okay. Is my screen visible?
Yes.
Right. So today I'll be speaking about a very crucial yet very underrated aspect of glaucoma management, which is ocular surface disease. So basically, OSD is not just synonymous with dry eyes. In fact, it's a group of disorders that affect the various components of the ocular surface, causing an alteration in the ocular tear film and disrupting the integrity of the ocular surface as a whole. OSD is a silent disease. It's just like glaucoma, but it's a silent epidemic as well. As per the literature, more than half of the patients of glaucoma who are using topical medications have coexistent OSD. In fact, it can also be a pre-existing issue in at least 1/3 of the patients. Thus, the burden of the disease is, in fact, very huge. Looking at the risk factors, the first and the foremost risk factor which connects both the diseases is old age. Both glaucoma and OSD are diseases of old age. Next is the severity of glaucoma. More severe will be the glaucoma, more medications will the patient be using, and that is going to invite more trouble. Next is preservatives. All of us know how big nuisance the preservatives are. Then the number of medications and the duration of therapy. Both of them are going to again be a huge risk factor. More the number of bottles and longer the duration, higher is going to be the risk of OSD. So if we try and understand the pathophysiology, at the heart of ocular surface disease lies inflammation. So it has been noted that in patients with OSD, there's an increased expression of inflammatory markers in the tear film, and this inflammation is going to produce an epithelial stress causing evaporation of the tear film, producing a hyperosmolar state, manifesting in form of dry eye and other associated surface issues. So what really is triggering inflammation in these patients? So here we are looking at two different culprits. First is the preservative, the most notorious of which is the BAC, that is benzalkonium chloride. And the next is the active ingredient, that is the individual drug molecules. Now, BAK is a very effective preservative, but at the same time, it is going to cause a lot of cellular toxicity. And this toxicity, as per studies, is both dose as well as duration dependent. Now, there is various studies in the literature that have compared the BAC-free molecules with the BAC-preserved ones, and these BAC-free agents are clearly they're better compared to the BAC-preserved molecules in terms of the tolerability, and there's a reduced incidence of the OSD. Whereas if we make a comparison in terms of IOP reduction, they are at par with the BAC preserved molecules. And this has been the major reason behind the decline in the use of BAK in the recent times. Now, it's not just the preservative that is to be blamed every single time. All the individual molecules, be it pilocarpine, timolol, brimonidine, prostaglandin, and the recent ROCK inhibitors, all of them are notorious in causing some sort of cellular toxicity. And thus, it's very unfortunate that none of the glaucoma medications are absolutely ocular surface friendly. Now, how will a patient with OSD present to you? Well, these patients can have different complaints such as redness, foreign body sensation, increased tearing, burning, stinging, itching, photophobia, and sometimes if the severity of the disease is very high, they may also complain of visual disturbances. These patients will have an abnormal T-bud, the Schirmer's and the tear osmolarity will be altered, there will be decrease in the tear meniscus height, they'll present with severe hyperemia of the limbal and the bulbar conjunctiva, there will be corneal and conjunctival staining, and they'll also show up sometimes signs of associated meibomian gland disease. Now, it is said that a picture speaks louder than words, and these different images here are a strong testament of how much our patients are suffering. So if you look at this picture here, this is the right and the left eye of a patient who has been on at least 5 different medications since the past more than 6 years. And we can see clearly how badly these medications have affected the health of the ocular surface. Next, here is a patient. She's a lady who has been using brimonidine for the past 2 years for treating her ocular hypertension. And as we can see here, this long-term brimonidine has produced this typical follicular reaction, which is a very common side effect caused by brimonidine, what I like to call the brimonidine bruises. Next, again, here is a patient for whom we recently added ripasudil, and it has caused this typical epitheliopathy, what we call the honeycomb or the reticular epitheliopathy. Then prostaglandins, as we all know, are a big time nuisance in terms of creating increased hyperemia. And this here is a beautiful image which compares a virgin eye with an eye treated with multiple medications. This is from a non-invasive meibography test. And as we see here, as compared to this virgin eye, the morphology of the meibomian glands is very badly affected in patients who are being treated with multiple medications. So I'm sure by now you all are clearly convinced that ocular surface disease is a very serious problem. Coming to the evaluation, for the subjective evaluation, there are various questionnaires available. And the most commonly one which is used in our daily practice is the OSDI. And for objective evaluation, you can do a Schirmer's test, the T-Butt, corneal and conjunctival staining with different vital stains. You can perform the meibography, tear film osmolarity. Many times you can also look at the inflammatory markers in the tear film and so on. However, in a busy OPD setting, in my opinion, the two most important tests which can give a lot of information about the ocular surface health are the T-Butt and the fluorescence staining. We are as such putting the fluorescence stain to check the intraocular pressure, and we just need to spare a minute extra to note the T-Butt and to note the pattern of the corneal and the conjunctival staining. Now, OSD is going to have a serious consequences on the life of the patient. It's going to decrease their compliance, which may lead to progression of the disease. It's going to have a negative impact on the quality of life, which is as such compromised in all our glaucoma patients. And it's a huge risk factor for surgical failure. Coming on to the management, which is the most important part of this discussion. Now, there are 4 different pillars of management. The first and foremost is identifying the problem. Now, as I mentioned earlier, it's a very underrated disease entity. And sometimes when the patients present with very early symptoms, we tend to miss it. Therefore, I would request that all of you should screen all your patients during every visit and positively look for signs of OSD. Next is to identify the culprit. You need to find out whether the preservative is the one which is causing trouble or a particular drug is causing trouble. If it is the preservative that you identify, you need to switch to preservative-free molecules. If it is a particular drug you think is causing the problem, what you do is omit that drug and switch to a different class. Often we need to take both these measures because most of our patients are on multiple medications and it's really difficult to pick who is the real culprit. Next is symptomatic relief. Now you need to soothe the ocular surface, for which you can use lubricant drops, gels, and so on. Now, one particular thing to note here is that lubricants should not be used for all the glaucoma patients. It's a very common practice that every prescription for a glaucoma patient will have a lubricant added to it. This is not a very good practice because lubricants themselves are having preservatives, which is definitely going to contribute to the OSD. So use the lubricants very, very judiciously. They're not required for every single patient. And lastly, we need to control the inflammation. And for that, for most of the patients who have mild to moderate disease, short course of steroid is enough. But for severe presentations, we can even consider using cyclosporin, tacrolimus, or sometimes we have to refer the patients to our ocular surface colleagues. So I'll quickly walk you through this case scenario of a middle-aged man with moderate primary open-angle glaucoma. He underwent a combined surgery a few years back and now has failed blebs in both his eyes, and he has been advised surgery for both the eyes, and he's come to me for a second opinion. Now, these are the pictures from his first visit at my clinic, and as we see here, he has severe OSD in both the eyes. And his current drug prescription comprises of nitarsudil, bimetoprost, brinzolamide, timolol, and the patient mentions that after he was started on nitarsudil, his symptoms have particularly worsened. So basically, this patient is using 4 bottles and total 8 drops in both the eyes. Now, there are 2 things which are fundamentally wrong in this prescription. Number one, the primary person has not thought of giving fixed dose combinations. And in spite of such severe ocular surface disease and the patient being so much symptomatic, they've never thought of using preservative-free molecules. So what we did for this patient was, since he was particularly unhappy with the nitarsudil, we omitted nitarsudil. We put him on a short course of fluoromethalon for a period of 3 weeks in a tapering dose. We switched to preservative-free molecules and fixed dose combination. So basically from 4 bottles, he was brought down to 2 bottles with 3 drops. And with this therapy, in a month's time, he was feeling much better. This is the picture after 1 month. He is reporting betterment in the symptoms. And as we can see here, there is drastic improvement in the ocular surface health. So, as our understanding about the ocular surface disease in glaucoma and the side effects of various drugs is increasing, we are seeing changing trends, especially in the Western world. The trend is now shifting towards early intervention. That could be in terms of a laser, that is SLT, MIGS, or even sustained drug release implants. And I think it's reasonably fair to consider safer and more sustainable options rather than letting a patient suffer for their whole life and also compromise the prognosis of future surgeries. So interventional glaucoma, in my opinion, is going to go big time in India very soon. Thus, to conclude my talk, I would like to give you a few messages. Number one, always look for ACD. Screen all your patients during all the visits. Less is more. Do not overtreat any of the patient. Limit the load of the preservative. Always go for less number of bottles, as less as possible. Lower the IOP, not the ocular comfort. Don't set unrealistic targets. Treat ocular surface disease promptly and think beyond drops. It's always a good idea to intervene early. Thank you for your patient hearing.
Dr. Karthikeya, sir, please. Thank you, Dr. Reenal.
Thank you.
Yeah, it was a nice presentation. Yeah, I agree. Many of the patients have some ocular surface disease, glaucoma patients using glaucoma medication for a long term. They have. One thing is the kind of patients which I see are very poor patients. So if I add some lubricant, no, what they do, they miss one out of glaucoma medication saying, sir, I'm using this medication regularly. This is good. So I usually avoid unless it is very important.
Correct.
So, actually, Dr. Preeti also wants to leave. So, we'll quickly have the reel by Dr. Manushi and then we can take on with
Nupur
the
ma'am, just to add on, Reenal, a wonderful presentation. Actually, I'm traveling. I'm not able to switch on my camera. I really loved your slides and the way you have, it was like, I love the way you presented of quality of life, how it really hampers surgical failure. And even, sometimes I've seen patients because of the ocular surface issues. That is the main culprit sometimes for complaints and adherence related problems as well. And you have summarized it really well. And kudos to you. And for the viewers here, I would tell you guys to see her channel as well in Instagram called the Glaucoma Charya. And I think that speaks volumes. So thank you, Reenal, for a wonderful presentation.
Thank you so much. It's
Dr. Reenal, we'll just take forward the discussion. We'll just have Dr. Manushi's reel and then
Please.
forward this discussion. Yes.
Yes.
Manjula, can you share the reel quickly, please, so that our judges can mark it? Yes. Manjula, are you there?
Yes, doctor.
Yeah, can you share that reel, please? Yeah.
Yes.
Yes.
And I also want to thank all our judges for being so patient throughout. It's not easy to judge more than 20 participants at a go. And you've been so supportive. You've given them such, wonderful comments about how to improve their performance the next time that they present and how they can make a reel or a artwork more informative and more effective to their audience. Thank you so much for your patience and thank you so much for your presence. We really appreciate you all.
Manjula, can you share?
Arshi, we are really enjoying. I think I am enjoying with the young people around. I think you feel that you tend to learn so many things from the younger generation also. So with so many innovative ideas, it's really good that I have participated in this.
जिससे हम अक्सर आँख चुराते हैं और वो हमारी नज़र ही चुरा लेता है। आज हम आपके लिए लाए हैं ग्लॉकोमा की कहानी, उसको जीने वालों की ज़ुबानी।
कुछ 15 साल पहले मेरे आँखों में थोड़े सिम्टम्स आने लग गए थे, जैसे कि आँखें सूखना, आँखों में दर्द होना, सफ़ेद लाइट में खासकर सात रंग दिखना, आईज़ में बहुत ज़्यादा डैमेज आया था। ऑलमोस्ट 3/4 विजन जा चुकी थी। ये मुझे पता ही नहीं चला कैसे हुआ। जब ये डायग्नोस हुआ और मुझे मेरे आई डैमेज का पता चला तो शुरू में मैं बहुत ज़्यादा अपसेट थी। ये पॉइंट एक्सेप्ट ही नहीं हो रहा था कि इतना ज़्यादा डैमेज हो गया है। फैमिली सपोर्ट से थोड़ा मदद मिली लेकिन धीरे धीरे एडजस्ट होने लग गए थे, एक्सेप्टेंस होने लगी थी कि ठीक है ये एक प्रॉब्लम है, इसका सोल्यूशन पे हमने ध्यान देना है, कंट्रोल करने की कोशिश करी। सर्जरी सक्सेसफुल भी रही। 5 साल के बाद राइट आई में आई ड्रॉप्स के बावजूद भी प्रेशर मेंटेन नहीं हो रहा था। फिर राइट आई का भी ऑपरेशन हुआ। अभी प्रिकॉशनरी आई ड्रॉप्स मेंटेन कर रहे हैं। 15 साल से ग्लोकोमा है मुझको एंड रेगुलर पेरीमेट्री भी करवाती हूँ मैं, और पेरीमेट्री रिपोर्ट के बेसिस पे ग्लोकोमा काफ़ी स्टेबल है। आईओपी जिसका मतलब इंट्राओक्यूलर प्रेशर, मेरी आंखों का प्रेशर अभी मेंटेन है। मुझे जब डायग्नोस हुआ था ग्लोकोमा तो थोड़ा फैमिली में छानबीन की तो पता चला कि मेरे फैमिली मेम्बर्स को भी था, जिसके कारण वो ब्लाइंड भी हो गए थे। बट अब आज क्योंकि मुझे पता है कि मुझे ग्लोकोमा है तो मैं अपने बच्चों की भी स्क्रीनिंग कराती रहती हूँ।
क्या 1 साल पहले मैं तो आँखों में धुंधला दिखा, एक आँख से धुंधला दिखा था मेरे को। ग्लोकोमा है क्या, मैं डर के मारे फिर एक बार यहाँ डॉक्टर के संपर्क में आया, मैंने बात नहीं है, तो ही नहीं इसके अंदर। बाकायदा समझाती रहते हो डॉक्टर की, लड़ने की जरूरत ही नहीं है। आप तो क्या ट्रीटमेंट आप डालते रहो, डॉक्टर के साथ कह रहे हो ऐसा करते रहो, चला करेगा।
2021 से ये प्रॉब्लम थी पापा को दिखाने के उसकी आई की, अब जो कि 21, 22, 23 में तो कंटिन्यू किया था हमने, बट उसके बीच में फिर कुछ इशू के कारण आ नहीं पाए थे। बट 2025 में आए तब तक तो आँख खराब हो चुकी थी। अब राइट आई में जितना भी जो भी दिख रहा है, जो भी यूजिबल विजन है, उसको हमें बचाना है।
Thank you, Dr. Manushree, for that beautiful reel. Yeah.
Thank you, ma'am.
Sorry for the technical glitch. Thank you, Manjula, for sorting that out. You want to say something, Manushree, quickly, and then we can have comments from you.
The idea behind the reel was that if the patients themselves tell the story, it will be more relatable to the general public. And secondly, all patients are little different. Their presentations can be different. Their lives are different. So different aspects are there. But one thing is in common, that to fight glaucoma and early screening and then regular follow-up. And I have stressed upon the fact that follow-up is very important, and regularity in the treatment, and whatever the doctor advises, they have to be compliant to it, may it be laser or surgery, and different symptoms and family history, of course. That was the gist about it. Thank you.
So much. Anything from you, Dr. Preeti ma'am, for Dr. Manushree's reel?
No, it explained everything what patients, that I stopped medicine for some time and then I suffered. There was some issue. This is what regular patients do. And so it depicted the real world problems we have when we tackle glaucoma. So it was very well done. Yeah. So congratulations to you. Yeah.
Thank you, ma'am.
Vinita ma'am, from you?
Yeah, very nicely done. Even Dr. Shweta has put in contest where she has called for 2 minutes video from all the MP members so that she can choose the one of the best video. The patient has narrated their journey of glaucoma. So probably it's like an eye-opening for those who are passing through that phase, and they can correlate their journey with the patient narrating the story. So it's a great idea, Manu. Thank you.
Thank you.
Judges. So this was Dr. Manushree's reel. Preeti ma'am and Vinita ma'am, you can just mark the mark sheet and send it on my personal message. I'll collate the marks. And can we have I think Dr. Vinita, Dr. Preeti ma'am wants to leave. Can we have a quick group photo, Arshi, before we...
Absolutely, ma'am. Sorry, I'll just stop screen sharing. I feel
Yes.
like I keep switching it on at the wrong time.
Can I request everybody to quickly turn on their video so we can have a screenshot with our judges? Priya, Rakhi, if you're there, Megha, Dr. Mehak.
All the participants who
All the
are still here, kindly
and
join
Manjula can help us
for the
take the
picture.
screenshot. Yes. Prasanna is driving. Yes.
Priya, Megha, Dr. Deepika, Dr. Shobhna, Dr. Megha.
Yeah. Manjula, can you take the... yeah, we can do the Yosi sign, Preeti ma'am. This is your sign that we do. Priya, your video. Manjula, screenshot done? Yeah.
1 second. Done, doctor.
Thank you.
Thank you.
Okay,
So
thank
once
you.
again, thank you to our judges, Preeti ma'am and Vinita ma'am, for being there throughout. And over to you, Arshi, Dr. Reenal. I'm so sorry for butting in that, discussion. Please carry on. I'll compile the results.
I think I'll just say thank you before I leave. It was really wonderful. And as Dr. Vinita said, we learned so much. So it was amazing. And all the best to Team Yosi. And congratulations for such an innovative webinar. Yeah. Bye-bye. Take care.
Thank you
From
so
my
much.
side also, I think all are winner. Just we have to mark, and it becomes such a difficult thing. Like you like so many things, but anyway you have to give the marks. So that's one of the difficult decision. But I think from my side, everyone is winner because they have all participated with their own innovative idea, and they did to the extent of maximum. I think that's a great learning when you see that everybody participating with such a great enthusiasm. We did it with a slogan competition, in Hindi or English, you can write a slogan on a glaucoma, and it worked very well. So I think with the newer things, maybe I don't know whether you have clearly mentioned to the reel or the art presenters that it is for the general public. I think we thought in a way that it is for the general public. I don't know whether they have been conveyed this particular message. So maybe
the theme was glaucoma awareness, ma'am. Yes, ma'am. Yeah.
Yeah, but then awareness may be of any extent. The public awareness is something which you have to be little different. As Dr. Preeti and other judges were feeling that it is like if it is for the public, the structure will be something different. And if it is like it's just an overall awareness, we all being doing awareness in our social media, and we put a lot of images which are related to glaucoma. I think it's a very clear way of depicting glaucoma is only optic nerve or the tunnel vision. So that's just a depiction, and I think everybody did it wonderful. And thank you so much, Yosi, for having such a wonderful year activities. It's enlightening to see so good, beautiful activities. And Arshi, as usual, very sweet, smiley face. Nupur, I keep on meeting, but then Arshi, Sunday only I met her. So thank you so much, all of you doing such a great work. And I invite all of you to actively participate in the forthcoming National Conference of Glaucoma, GSI, that Glaucoma Society of India at Bhopal. And I personally invite all of you to see that conference and make that conference wonderful by your presence.
Thank you so much, ma'am, for all your supportive comments. Ma'am, I think the next time we're going to take up the slogan activity too, right, Dr. Nupur, ma'am? And
And
probably
maybe more
tell the
clear with our theme
participants
as well.
a little
Yes.
better that this is going to be just for patient awareness. So they should concentrate on educating the common man. Thank you so much, ma'am.
Thank you. Bye-bye. Good night.
Bye, ma'am.
I'm
Good
just
night.
sharing my results. Thank you so much.
So we will have the discussion in a while, but before most people get worried about their dinner, we really want to have Dr. Madhavi's talk. Dr. Karthikeyan, sir, if you could please introduce Dr. Madhavi, ma'am.
Our next speaker is Dr. Madhavi. She's a senior glaucoma consultant and a MIGS surgeon at Velur, Tamil Nadu. She's formerly working as a glaucoma consultant at Aravind Eye Hospital, Tirunelveli in Tamil Nadu. And she has operated many minimally invasive glaucoma surgeries. And she's an excellent surgeon. Moving on to her talk, please.
Madhavi, ma'am, if you could please share your screen. We've been looking
Yeah,
for
sure.
since the beginning.
Thank you. Thank you. Thanks, Yosi, for the invite. And it's a great honor to be part of the Glaucoma Gyan Talk. At the outset, I would like to thank my good friend, Dr. Prasanna, Dr. Arshi, Dr. Nupur, for inviting me for this webinar. Just give me a moment to share my screen. Is my screen visible?
Yes, ma'am, it's visible. You can.
Yeah. Yeah, is it full screen?
Yes, ma'am. Yes, ma'am.
Okay, so today I'll be talking on pano maps in glaucoma. Right now we have seen so many arts. Let's get into maps. I have no financial disclosures. With World Glaucoma Week around the corner, once again, it's time for us to remember that we share 1/5 of the global burden, and we are expected to see around 3 crores by 2040. So what is the key? Early diagnosis is the key. Dr. Reenal mentioned we have to go for early intervention. For that, we need early diagnosis. So initially, historically, the definition of glaucoma just revolved around intraocular pressure, but right now it has gone on to optic nerve. So it is a chronic progressive optic neuropathy with visual field changes, which may or may not be associated with a raised intraocular pressure. What does the World Glaucoma Association say? The clinical diagnosis of glaucoma is predicted based on a thin retinal nerve fiber layer and a narrow neuroretinal rim. And it also mentions that the diagnosis of glaucoma does not always require the detection of visual field defects with perimetry. This again highlights the importance of structure versus function. So as you can see in this graph, this is where we want to detect glaucoma. That is progression in the green, not even in the pre-perimetric state, but before that, even before that. Then comes the RNFL defect, followed by the optic nerve head changes. And last, when visual field gets affected, we have almost lost 50% of the retinal nerve fiber layer. So the window period, as we all know, for that is around a period of 6 years. So the optical coherence tomography, which has been there for around 50 years, is a good tool to assess the optic nerve head structure. So OCT looks at the optic nerve head and the parapapillary retinal nerve fiber layer along with the macular ganglion cells. So initially it was just the optic nerve head and the peripapillary retinal nerve fiber layer imaging that was utilized. Later on came the ganglion cell analysis. So what exactly this ganglion cell analysis does is that it actually uses the RNFL along with GCL and IPL, that is called the GCC. What is the rationale behind going for the retinal ganglion cells? We know that more than 50% of the retinal ganglion cells are located in the macular region, while the Cirrus OCT utilizes only the GCL IPL. We would actually like to segment between GCL and IPL, but hardly many machines find it difficult to segment between GCL and IPL. So the ganglion cell analysis of the macular cube of the Zeiss Cirrus OCT gives a combination ganglion cell layer along with the inner plexiform layer, that is a GCL and IPL. So this is like the chicken versus egg conundrum. RNFL versus GCC, what got affected first? So some studies say that the macular changes appear first before the RNFL changes, while other studies say that the diagnostic capability of RNFL is superior to the ganglion cell complex. So what exactly is a panomap? Pano means panoramic. So it uses a integrated wide field assessment of the posterior pole. So you have a optic nerve head and the surrounding parapapillary retinal nerve fiber layer along with the macula GCC, all integrated together in one report. So that is the panomap. This is available with the Zeiss Cirrus OCT. So you have seen in this map, you can have a topographic analysis on the left side, and then comes the deviation map. Then you have the GCL plus IPL sectoral analysis, and then you have the thickness values. On the right corner, you have the disc and the RNFL thickness measurement values. And then you have this part that is a TSNIT graph, which is already a part of your optic nerve head analysis, and then the macular thickness. So these are the parts of the panomap analysis. So let's look at some case scenarios, how panomaps can be used. So this is a 77-year-old female patient who came to us, and you can see that the right eye has a clear inferior rim thinning along with an RNFL defect, and the left eye looks a little bit suspicious. So on looking at the RNFL map or the optic nerve head RNFL map, you can see that the thickness map clearly sees blue areas of thinning. The RNFL defect is seen here, which is also seen in the deviation map. Again, this correlates with the quadrant analysis and the clock cover analysis. But then again, if you look at the left eye, this appears seemingly normal. So this looks suspicious with the bezel bending here, you can see. Then this is the visual field analysis showing a defect in both the eyes. So let's look at the ganglion cell analysis. Now this shows something interesting. The right eye, you can see what is correlating with your RNFL map. But in the left eye also, we are seeing a sectoral defect which was not seen in your RNFL map. So let's have a look at the panomap right now. So this is the panomap of the right eye. You can beautifully see how the RNFL goes and pans around the macular area, this RNFL defect as well as the ganglion cell analysis integrated together. Now here if you see the left eye, now you can see that the defect has started in the macular area, but it has not reached the RNFL area. So this is one example of where the defect starts in the macular ganglion cell region. So let's look at another interesting case scenario. So here you can see that the right eye and the left eye both shows RNFLDs, which is very clear in both the here. So this is the macular ganglion cell analysis showing the ganglion cell thinning in the deviation map, the thickness map, and which is also seen in the sectoral analysis. Interestingly, the macular ganglion cell analysis in the other eye looks completely normal. So this is the RNFL map showing the defects here, and again the left eye you can see a clear-cut wedge, beautiful wedge defect, and this is also depicted in the clock cover and the quadrant analysis. And this is the visual field effects, and this is also correlating with your RNFL map. Let's look at the Pano map. So here you can see that this RNFL defect, the superior, inferior, and how beautifully it is correlating. And here only the RNFL seems to be affected first, but then again, if you see the Pano map, it has already started coming towards the macular region. However, if you only look at the macular GCC, you can see that it is seemingly appearing normal. So I have given two case scenarios, one in which the macular GCL IPL was affected first, and the second case scenario where the RNFL defect was appearing first, but the macular GCC seems normal. So this implies the importance of using a Pano map. So again, another case scenario in which there is an asymmetric involvement. Look at the left eye, how advanced the glaucoma is. While you look at the right eye, which seemingly appears normal, but then again, if you look at the Pano map, you can see that some early defects have started happening. And then again, another example in which only the RNFL is involved and the GCC is appearing normal here. While this eye, you can see both the RNFL and the GCC has been affected. So this Pano map, some studies have shown that they have good correlation in pre-perimetric as well as moderate stages of glaucoma using a Pano map, that is a wide field analysis. And this axillary Pano map even shows the progression in papillomacular bundle defect progression, especially associated with the fovea disc hemorrhage. One more interesting thing is not only for diagnosis, but it can be also used for detecting progression. So this particular study utilized a GPA Pano map. So we know that there is a Pano map available and an RNFL GPA, GCIPL GPA, which is available separately. So these four are the maps which are available in the commercial OCT reports, while this proposed study used a GPA Pano map for understanding the spatial relationship between the peripapillary and the macular areas. So another interesting study, which this study utilized a swept source OCT using a Triton OCT. So this is very interesting in the fact that this compared a Pano map progression analysis with a RNFL thinning progression analysis and a GCIPL thinning analysis. So if you see here, the progression was detected first using a RNFL GCIPL thinning. That is a Pano map. It was detected around 4 months before it started appearing in the RNFL and even before the GCIPL. So this implies the importance of using a Pano map even for progression analysis. Apart from using in OCT alone, it can be incorporated in OCTA, that is OCT angiography also, for detection of high myopic glaucomas. So what is the importance of this single glance maps? As we all know, we have surpassed the goldfish in terms of attention span. Right now, I think everybody's attention span is off the charts. So I'll keep it short and sweet. Because of busy OPD, we need a map that will give us easy interpretation at a single glance. So some of the other combined maps, this is not exactly a Pano map, but this is a map in the Spectralis, which gives a combined report. Here you can see an RNFL minimum rim width along with the ganglion cell layer thickness. Just one point I would like to make in Spectralis is the only OCT probably which delineates the or segments the ganglion cell layer from the inner plexiform layer. So that is the importance of Spectralis. So this is another important tool which is available with the Zeiss forum analysis. So you have the structure function analysis report where it actually, what it does is the OCT is overlaid on the visual field analysis. So on the top, you can see the visual field analysis. And here you can see the right eye structure, the left eye structure. So in the center, you can see the structure function correlation map. So what it actually does is the OCT data is flipped over on the visual field data for good comparison. So as we all know, correlation is the key to glaucoma diagnosis and management. So something interesting in upcoming or in the pipeline is ROTA, that is the retinal nerve fiber layer optical textural analysis, which was described by Christopher Leong et al. What it actually does is it uses a novel algorithm and combines a wide field map and uses reflectance image as well as RNFL images to create a ROTA map. So this ROTA map is supposed to detect glaucoma even earlier before the OCT RNFL maps. So what are the drawbacks of using a panomap is that the consistency of the fovea disc relationship are not that great. And the quality indices sometimes we can overlook, especially the segmentation part, which is not there in the panomap. So it should not be used in isolation. Rather, it should be used along with the ONH map as well as the GCC map. To summarize, currently, so now we have the answer to the chicken egg conundrum. The combination of RNFL and ganglion cell analysis is considered the best approach to OCT based glaucoma assessment. The panomap, which is nothing but a wide field integrated image, is a useful and easy adjunct. It helps to assess areas surrounding the optic nerve head, which may be missed with focused imaging techniques. To conclude, the emergence of these accurate, sensitive, and reproducible imaging is nothing but complementing our good clinical judgment, which has revolutionized glaucoma management. And of course, there are exciting prospects in the pipelines with artificial intelligence also coming in the pipeline, which is expected to make the glaucoma diagnosis and monitoring easier in the future. Thank you for the opportunity.
Thank you, ma'am. Such a wonderful presentation. I hope everyone understood how to read the RNFL panomaps and advanced techniques. Okay.
Madhvi ma'am, that was absolutely worth the wait. Such a comprehensive and I would say even with the lowered attention span, it was something that, suddenly opens your eyes. And this is something that not everyone gets to see because not everyone has his IS machine. So I think it's very educative for whoever is attending, the postgraduates especially. Thank you for elaborating it so well.
Thank you. Thank you for the opportunity.
Nupur ma'am?
Yes, Arshi. Hi.
Thank you, ma'am.
In the meanwhile, I would like to thank Nupur ma'am for giving me the opportunity to be a moderator in this time.
No, I think I should be thanking all of you for, putting up such a beautiful, coordinating everything so well. Arshi, you want to share the screen once?
Yes, ma'am, I would like to just, and then we could have the closing remarks, ma'am.
Yeah. So we have the we have the results for you all. So without further delay, it's already quite late. I'll announce the results. So the first prize for the glaucoma reel contest is by Dr. Devika Vasudevan, and the second prize is by Dr. Shobana. So congratulations. And for glaucoma awareness through art contest, the first prize is won by Dr. Neha Rashid, and second prize is Dr. Deepika Biraka. So it's been a very tough call, very close competition. So congratulations to all the winners, and we'll be giving away all the prizes at the YosiCon, the second annual YosiCon that's scheduled 5th to 7th September at India Habitat Center, New Delhi. So to all the audience who are watching and will be watching on the YouTube later, so the registrations are over. Please utilize this opportunity to submit your abstracts. The last date is 1st May, and this is going to be a wonderful conference, 3-day conference with a lot of academics, lot of camaraderie with the entire Yosi gang, and we look forward to having you all. And also please register for the conference if you haven't yet. So with this, we come to the end. Is that the end, Arshi? We don't have anything.
Yes, ma'am, that's the end. We are at the thank you slide.
Yeah. So thank you so much. So at the outset, I would like to thank all the judges and panelists for tonight. Dr. Satyan, Dr. Vinita ma'am, Dr. Preeti ma'am, Dr. Gauri ma'am, Dr. Aparna ma'am, for taking out time from their busy schedules, being with us throughout, be commenting for each and every entry, giving pointers, and, being with us. Thank you so much to all the judges. I would like to thank the entire governing council, Dr. Devakan, Dr. Nilesh, Dr. Prasanna, for their unending support to all our endeavors. And last but not the least, a huge thank you to all the moderators of the session today, Dr. Arshi, Dr. Priya, Dr. Rakhi, for wonderful, for having this so seamless, to coordinators, Dr. Prasanna, Dr. Karthikeyan, and to the entire socio-cultural team and the glaucoma focus group, and to all the participants today, for sending such wonderful, overwhelming entries. Really, to be honest, we were not expecting so many entries in such a short span of time. And what a wonderful job each of you did. As we always say, that winning is just a formality, it's participation that's most important. Each of you here is a winner. And thank you for all your efforts, and please keep participating in all the Yosi contest. That's it. Congratulations to the winners. Arshi, if I've missed out on somebody, you can just add.
You missed out thanking yourself. You were the person behind this all, the heart of soul of it. You've coordinated everything despite so many other commitments. And I think it went really well. It would be a learning activity for all the residents. And as you said, everyone did so well. I was amazed at the creativity that they had, and the kind of videos they made, the smart art that they used. It was so interesting to see.
Absolutely.
Kudos to everyone who participated.
Absolutely. I think, having that, we saw so many postgraduates participating today. So that is so nice, people coming up and participating. Keep participating. I think it's been a wonderful. Thank you, Arshi and Karthikeyan, Prasanna again. Thank you, Priya.
And
for
thank you,
always
Manjula
having
ji.
my back.
Thank you so much, ma'am.
Yes.
Thank you, Arshi, ma'am.
Yes. And Arshi, Manjula, we can stop the lights.
Thank you, Manjula ji. Thank you, Numratech.
Thank you. I always forget the most important, thank you, team Numratech, Manjula ji and Sai ji, for all the technical support. Thank you so much.
Doctor. Welcome.
All
All
right,
the flyers
it's a
and the-
wrap. Thank you again, Dr. Madhvi and Dr. Reenal.
Yes, I forgot them for our glaucoma gyan. They were the crux of our webinar today. Dr. Madhvi, Dr. Reenal, for wonderful presentations. Thank you so much. And
Thanks. Thank you, Dr. Nupur. Thank you, Dr.
Good night. Everyone can get to their
Good
dinner
night.
now.
Yes, please.
Okay, good night, ma'am.
We are